Over the years, and especially beginning in 2016, we started looking at public health approaches to prevention. What can we do to get all sectors of the community engaged in preventing the risk of violence before an individual even begins to think that violence is an option, or violence is justified, or the only answer?
The value of a public health approach is that it looks at violence from a public health lens, that the social and environmental factors that people are living in can actually lead them to an increased risk for perpetuating targeted violence. And the value of a public health approach is that it looks at targeted violence prevention from kind of a three-tiered approach.
When we use primary prevention, what are we talking about? We're talking about raising the barriers to entry so a person never even starts down that path where they think violence is going to be the solution. Our secondary interventions is actually when someone is already at risk. They've already started down a path towards violence, and now we're trying to find ways to off-ramp them. When we're talking about tertiary prevention or tertiary intervention, they are already committed in that space of using violence. And now the question is, how do you pull them out of it?
If we're thinking about other forms of violence that we seek to prevent as a society, that we look at as public health crises, that would be gun violence prevention, domestic violence prevention, other forms of violence prevention. Putting targeted violence and terrorism prevention within that frame enables communities to see that they have a role. The whole of society has a role to play in preventing targeted violence and terrorism and building resilience in their communities and in the individuals within their communities.
Our efforts are focusing on a whole of society, public health informed approach where civil rights, civil liberties, and privacy protections are injected into every aspect of our work.
Law enforcement can't get involved until the bad thing has already happened, but a teacher or a pastor or a social worker can see these things as that, they can see the radicalization process as it happens. They can see community unrest before it kicks off. And also they have the relationships in place to jump in and do something about it.
Prevention is trying to find how we improve relationships between people. It's also understanding how do we improve communities and the services and support that those communities offer to individuals. Or are there resources we need to try and prioritize to fill unmet needs that might be leading individuals to have a grievance and could lead them down a pathway to violence?
I see prevention as really pursuing the absence of something, and all these pieces go into forming a healthy and safe society beyond just stopping the bad guy with the gun. It really has to be something bigger.